Okay, so it's 3, 2, 1. We are live to the audience. We can start the meeting. Over to you, sir.
Good morning, friends, and welcome to Live Pharma Coalition, a global knowledge platform for pharma professionals. At the onset, we would like to thank you all for your continuous support and encouragement to our episodes, where we invite industry experts to share their views on current challenges and the best practices. As you know, Live Pharma Coalition is evolving. Now we are not only having physical interaction, but also we are planning very frequent uh, online as well as physical, both the interactions. So in this juncture, we would like to share with you our journey so far. Global knowledge platform, as you know, started 2 years back, and now it has taken a big shape of more than 30 core team members and more than 100 speakers who are continuously supporting us in our journey of learning and sharing. And recently we had LPC 100 conclave, which was a grand success, and taking the lead from that, we are coming out with many more such events in near future. Some of the eminent speakers who have graced the occasion in LPC 100 conclave, we are grateful to them. Some of the women leadership panel members and the global knowledge partners. We are thankful to Imagica Health for their continuous support on live streaming our session and connecting with us, with you all. And come to today's episode. It is LPC 108, Young Leadership. And here we have two of our core team members who are going to share their views on two interesting topics. First speaker today, Mr. Pankaj Srivastava, founder, Winning Ways Training Consulting, and sir is going to share with us importance of trusting relationship in pharma industry. Very, very relevant topic in today's context, where attrition is a big problem in the organizations. How a manager can build trusting relationships with the teams. On the other hand, our core team member Arpan Kumar Paul, the motivational speaker and Pharma story consult, is going to share with us stories on situational leadership. Very, very apt to understand different type of situations and how a leader should behave according to situation. So a lot of learning in the ED today. We look forward for an interaction. I would like to now introduce my co-panelist, Mr. ICS Verma sir and Mr. Sudeep Bhaumik, Zonal Sales Manager in Irundakar Pharmaceuticals. Thank you very much, Sudeep, for joining us as a core team member. And over to you, ICS sir, for the overview of the topic.
Thank you, Yashwant. And once again, welcome all the two renowned speakers who are, who actually don't need much introduction because they are with us from last 2 years and been into, a lot of leadership development programs. So I welcome once again Pankaj Srivastava sir and Arpan Kumar Paul. Good morning, both of you. Sir, Pankaj sir, can you just brief about the topic which you are sharing today?
Thank you, Vermaji, and good morning to everyone. Well, the topic which has been assigned to me is the importance of trusting relations in pharma business. Now, see, it's a very vast topic because if you see the entire ecosystem of the pharma business, there are pharma companies, there are, the marketing practices of the pharma companies, there are doctors, and there are relationships between doctor and patients. Now, I'm going to cover the entire ecosystem of this within that stipulated time. And I hope I'm able to bring some insights into that.
Excellent. I think, the starting of this physical actually put a lot of stress on even relationships and, the in vice versa for the doctors as well as within the teams. So I think the topic is very relevant, sir, and hope we will have a lot of insights on this. Thank you very much. Arpan, can you please give a brief introduction about your the topic on leadership and stories?
Thank you so much, ICS sir, and good morning to everyone. Yes, well, there is a twist in the tail today. I'll be a speaker, and Yashwant sir is going to moderate. So it's always said that when the going gets tough, the tough get going, because they innovate. So a leader is one who knows how to deal with a particular situation. He has to be very flexible, and that flexibility of a leader determines how successful he or she is, because the captain can only be good as the team. So if the team is good, the captain has to wear different hats in different situations. And that is exactly what I'll try to bring out from the story that I'm going to narrate on situational leadership. That's all from my side, sir.
Awesome. And we also have Sudeep Bhaumik with us. Sudeep, welcome to the panel. Can you just share about yourself as well as LPC journey, a brief introduction? You're on mute, Sudeep.
It is a miracle journey for me to join in the month of May 2020 when this pandemic has started. So from the 8th episode, I have started to see, and I have not missed today's 108 episode. I have not missed a single episode.
Great.
So I am very much accustomed with the LPC group, which I have upskilling myself, and I am very proud to be a member of this LPC group. This learning and sharing is such a things which makes the people always moving forward. And myself, actually, basically from Calcutta, I have started my career at 1996. Around 25 years experience I am having. Now I am working as a zonal business leader in Renocare Pharmaceutical company. Is based at Hyderabad, taking care of Telangana, Andhra. So it is about brief description about.
Thank you, Sudeep, and welcome once again to the LPC 108. You can now take over.
Yeah. So it's my great pleasure to introduce Mr. Pankaj Kumar Srivastava, a Pharma professional, which close to 40 years of experience, worked for 33 years, mainly for Sanofi, Aventis, and MSG, Pharmaceutical Private Limited. He has done different roles in the sales, marketing, and training. Mr. Srivastava has a special interest area in his help the pharma professional and medical practitioner to developing the life skills, soft skills, which they can have a profound impact on the people with whom they have interact. Mr. Srivastava is a very well-known figure in the pharmaceutical industry in India and abroad, and he has conducted more than 60 soft skills sessions with endocrinologists and diabetologists and paramedical staff in their hospitals, as well as in the national and international diabetics and conferences. He is also an author of Batting Career Complexities. He is a founder Winning Ways of Training Consultancies, and he is a very well master trainer for NSDC and ISTD and Blockchain of India. So it is the introduction for Mr. Pankaj Srivastava. So over to Pankaj Srivastava.
Thanks, Sudeep, for these kind words. I hope I'm able to do justice. Now, coming back to this today's topic, like importance of trusting relations in pharma business. And let me first of all share my screen. Okay. Now, when this topic was assigned to me, like importance of trusting relations in pharma business, I was just thinking about what are some of the major organizations globally as well as in India. And, companies like Walmart, Amazon, Apple, even if you see in India, Reliance, TCS, HDFC, Hindustan Levers, these are some of the organizations, they have been doing extremely well. And if suppose somebody asks as to what is one main reason for all these organizations to do so well? Immediately, one thing will come in our mind that, look, there is a lot of trust with these organizations. Think about it. I mean, when I purchase an Apple Watch or an Apple phone or anything related to Apple, along with that, there is some amount of reassurance which also comes. That is one. Same is the case with Amazon. I mean, online, uh, uh, anything if you want to order, you are absolutely sure that the same thing which you have selected in the catalog is going to be delivered, right? And in case, I mean, you are not so happy with the delivery, or due to some reason the product you feel is not appropriate, you have got the option of even returning that, and they will reimburse the money. So when this type of trust, these organizations, they have been able to develop, and all these organizations, I mean, you take Hindustan Lever, there is some amount of trust which immediately comes to our mind. Now, can we say the same thing for the pharma industry? Well, I will say that we will have mixed feelings and mixed impressions, right? So what am I going to do here? You know, I am going to discuss and share three layers. The first layer is, of course, between industry and public by and large. What is the impression of the public when it comes to the industry, right? Pharmaceutical industry globally as well as even in India. Second layer is what happens between industry versus doctors, because the interface between doctor and industry, again, is very, very important to infuse that sort of trust and confidence. And the third one is between doctor and a patient, right? That is how the whole journey is completed. So I'm going to discuss all these three facets of what are the reasons why trust deficit is coming, and how can we plug to a large extent this trust deficit. What is there? Because trusting relationship in this entire ecosystem is extremely important. So that's what I'm going to attempt in the next maybe 20-25 minutes. Now, I mean, if you see, for instance, why this trusting relations in pharma business is needed. I mean, that's one question which immediately may come. I mean, we are not dealing with any consumer durables. We are not dealing with any other type of products. We are dealing with human health, right? And there can't be anything more important than human health. Therefore, it becomes extremely important for all of us, those who are in this ecosystem, that there should be absolute clarity.
We have lost him, or I think there is a technical problem at Pankaj sir. It seems there is a power failure or something. So please bear with us for a few minutes, few seconds. We'll be back again.
Okay, till the time I am getting connected through the laptop, I will just continue that. I'm sorry.
Yeah, please.
As I've shared with you, there's a lot of power failures which are happening, and though I've got the backup, but still it takes little time.
Understood.
So as I was sharing with you all that anyway,
Sir, you have to use only one device so that there will not be any echo. I think there is a technical issue there again.
So can we go to next speaker? That is
Sorry.
You're
Sorry.
back? Okay.
Sorry. No, it was my mistake.
You're back? Okay. No problem. Go ahead.
So I'm still hearing a lot of echo, I think. Okay. So as I was sharing with you that there have been some bad instances in the industry, and I can easily recollect at least 10 pharma companies who have been fined to pay from $345 million to as high as $3 billion, right? Due to various wrongdoings in past. Now, imagine when these things, they get printed in the print media. Now we are in the era of internet where, any bad news travels far-flung areas. So when that was the case, there was a very bad image among public. And mind you, all these companies, they are extremely renowned big companies. Sorry, when this can happen to such renowned companies, think about it. What can happen to some of those organizations which are trying to establish themselves? So this was something which was extremely bad, I would say, in the industry. And we always say that trust is earned when actions meet words. And all these organizations, when they were claiming that, look, they are extremely careful about the data privacy, they are extremely careful about, the research, what they've been doing. But still, due to various reasons, when they were in bad news, there was a lot of, I would say, wrong impressions which were created among masses. So that is one. Secondly, if you ask me what were the common reasons for this trust deficit between companies and public by and large, there were many. Not one or two. I'm going to share with you 9 reasons because of which all these companies, they were fined, right? So some of the common reasons were, for instance, price violations. Now, can you imagine, a price which has been fixed by various governments, somehow they were circumvented with that, and there were some price violations. For that, they were fined. Fraudulent billing, because in many countries, can you all hear me? In many countries, the insurance they pay. So there were some fraudulent billings also which were associated. Off-label promotion, which is again very common thing. For any drug which you are going to promote, there's a approval which has to be taken, like in India from DCGI, and we are supposed to promote only in those indications. Same is the case globally. Now, when you are promoting in something for which you don't have data, or for which, like for instance, the approval is not there, that's an off-label promotion, and many companies were found doing this off-label promotion. Fourthly, failure to provide safety data. I mean, we say that, look, I've got a lot of safety data, but when the authorities, they ask the safety data, they were not able to provide that. Paying kickbacks to physicians. Again, I know, like in China, there was one company where the managing director had to resign. And I mean, that's one instance what I'm quoting. There were many such instances, right? False and misleading statements in their promotion. So, I mean, thing which you cannot prove, but still those things were being promoted. Poor manufacturing practices. This was another reason. Medicare fraud. And lastly, underpaying rebates. I mean, they were supposed to pay rebates to the patients and hospitals, but they were not doing that. So these were some of the reasons because of which there was huge amount of trust deficits between companies and public by and large. So, I mean, if you take a survey and ask which are the companies where the public by and large have got a lot of faith, their trust is very high, and what are the organizations where the trust is slightly low? I mean, maybe companies like Amazon and Apple and all that, they were, featuring very high, but pharmaceutical companies, in spite of, I would say, doing human services, but due to some issues, they were not having the same type of favor from the public by and large. However, things are slightly improving, I would say, off late, and thanks to a lot of efforts by these companies, especially, I would say, all those organizations who are traded in New York Stock Exchange, right? So they want to be absolutely sure in any part of the globe, there should not be any such instances which brings bad reputation to these organizations. So they are very careful about it. They don't mind doing business also. They will say that, look, we will not do business, but if there's some activity because of which they are going to get bad name, they will try to avoid that. But good thing is that of late, even in US market, slightly it has started improving. And this is one data which clearly says that trust in pharmaceuticals has increased in 16 out of the 26 markets, right? And if you see India here, in India, of late, the trust is improving. So, I mean, public by and large has started appreciating that, yes, pharmaceutical companies are taking some measures because of which at least, they are on the right side of the dealings. But the same thing cannot be said about all these countries which have been mentioned, right? So these are the distrust, this is the neutral countries, and these are the countries where trust is slightly improving. So this is the scenario globally, right? Now, how can you restore trust in the pharmaceutical industry? By translating expectations into action. So there was a survey which was done by PwC, PricewaterhouseCoopers, and they have suggested certain measures. So what were the measures which they had suggested to restore faith and trust among masses, right? So they suggested that, you have to restore trust in the company's choices and processes regarding drug discovery and clinical development. So they said that you need to be absolutely clear and you need to tell the public that, look, this is one arena where I am going to concentrate. So there will not be anything like ad hoc that there is some requirement and suddenly you will jump into that, leaving aside your core arena. So like, for instance, you will notice some of the organizations, they are being associated coming out with anti-cancer drugs. Some of the organizations are known to come out with anti-diabetic, anti-hypertensive, like that. So you need to be very, very clear that what is your core area so that public by and large knows that this is the core competency of this particular company. Secondly, they suggested that you need to refocus sales and marketing activities on improving the efficacy, safety, and compliance of patient treatment. Now here, I want to take a pause and I want to share with you that of late, I mean, for last almost, I would say 10 to 12 years, most of these organizations, good organizations, some of the leading Indian organizations, they are very firm on compliance, right? So any activity which they feel is going to bring disrepute to their organizations, they are shunning away from that. So that is a very positive development which is there. Thirdly, of course, you need to foster a culture of compliance and patient-focused behavior. So, these organizations, what the PwC has suggested that, look, you need to come out with innovative solutions which are going to be helpful for the patients. So your marketing activities also should be aligned towards patients. And that's why we quite often hear patient-centric interactions, patient-centric marketing inputs. So that is what. And when you are doing that, that should be within the ambit of certain compliance. So that is what most of the organizations, they have set up a compliance department, which was not there 15 years back. I can tell you. Now, most of these organizations, they have got a well-developed compliance, and they look into every minute activity. I mean, what gift you are going to give, what, the symposiums you are going to give, what is the intention of these symposiums, etc., etc. So that is what they do. Thirdly, explain the broader benefits of medicines the industry delivers. And when I was preparing this, I came across one incident where one of the organization, they were coming out with an antidepressant tablet. And they realized that, patients, they were dropping off after 10, 15 days. And then they further realized the insight what they got was that whereas that drug starts acting after a patient takes for, say, 1 month, then only the impact of that medicine is. But that particular aspect was not properly told to the patients. And because of which, when for first 15 days, they were not getting adequate response, they were dropping off. So that's one example I'm just sharing with you. Similarly, when you are giving out any medicine, anything, you need to educate the public how they should take, what are the advantages, what are the disadvantages, what are the contraindications, etc., etc. So more patient education related activities you must conduct. So this is one way by way of which, as per the PwC, you will be able to restore, the industry will be able to restore the trust between public as well as pharmaceutical industry. So that is one. Of course, I must say OPPI and ITMA also have given certain guidelines to the pharmaceutical industry. OPPI deals with all the multinationals and ITMA deals with all the Indian companies. And they have also given certain guidelines by which they should conduct themselves in the industry. So that is one. Secondly, I move, of course, educate public, as I've said. Secondly, if I share with you what are the common barriers between pharma industry and doctors, because that's another arena whereby the public by and large feels that, look, that everything is not fair. So what are the common barriers? Let me first of all highlight that. First is, of late, fact of the matter is doctors are less reliant on pharma industry for product and disease knowledge. I mean, now with the advent of internet, and they have got access to all the scientific journals, etc. Gone are those days when the doctors were completely dependent. I've seen that era. I mean, 30, 40 years back, the doctors were completely dependent on the pharma industry for the scientific dissemination of knowledge. Today, we cannot say that. So when that is the case, whatever pharma colleagues they are going to do when they are meeting the doctors, what sort of value add you are going to have? Because you are, I mean, if you are just going and sharing that, look, this is one product, doctors are not very keen about it. And that's why there's a lot of problems which are happening between pharma company representatives as well as doctors. Lack of time for pharma reps. I mean, that's also a fact. That is what is happening. Too many Me Too products, no differentiation. I mean, think about it. Fact of the matter is, when any research molecule comes from any organization, I mean, there's a patent which is granted because they have spent a lot of money. They will be charging slightly more. And when the patent goes off, there will be 100 companies, they will be coming out with the same molecule. So when this is the scenario and the market is flooded with so many Me Too products where the product differentiation is not very clearly well defined. There was also one study which was done long back that how many products a doctor can remember of a particular therapeutic group. And that study showed that by and large, there are 3 or maximum 4 brands which a doctor can remember of a particular therapeutic group. Now, when that is the case and the market is cluttered with so many me-too products, the doctors are just not interested. And that also creates a problem between a pharma company and a doctor. Doctors want to rely on publications rather than company claims. And of course, with the COVID, thanks to COVID, I would say that we are all connected like this because we all know that now digital adoption is pretty good among pharma companies as well as among doctors. And many young doctors, their preference is towards digital interactions. However, I must add that still there are quite a good number of doctors, they will insist that no, physical meetings, they are the best ones. So, I mean, you need to find out which is the preferred mode of action. But these are some of the, I have highlighted some of the points in this slide, which creates rift and which creates trust deficit between pharma companies as well as doctors. Now, I have prepared just 2 slides on the guidelines of MCI, Medical Council of India, because these guidelines, first of all, if you see MCI, it's a body which is quasi-government, quasi-judicial body. It's not a law what they have suggested. These are just the guidelines. When there are certain guidelines, it is left up to the concerned person to either follow or not follow. But then these are some of the guidelines what they have suggested for the medical practitioners. MCI guidelines are not binding on the pharma companies. MCI guidelines are binding on the doctors. OPPI and IDMA has given certain guidelines to the pharma companies. But pharma companies on their own also, those who are very careful about their reputation, because if reputation gets marred, their businesses in many other countries could be affected. So they themselves have taken a lot of proactive measures. But then these guidelines I'm just sharing with you has suggested few things for the doctors. Now, for instance, of late, it says that any doctor who has received more than 1 lakh, he could be deregistered for more than 1 year, or any type of hospitality. MCI guideline says neither you should take nor your family members should take in any form, right? Whether travel, cruise ticket, hospitality, paid vacations, etc. And why have I mentioned this? See, there have been few instances where the companies in block, they had taken doctors to some exotic locations. I don't want to name them, neither those companies nor those exotic locations. But then fact of the matter is, yes, they had taken, and when they came back again, it got published in the newspapers. Now, all these such instances, again, brings a bad reputation to the group asset for the pharma industry as well as for the doctors. So these are some of the guidelines. But again, MCI also, I must say, was under some amount of corruption charges. So when that is the case, when the walk the talk is not there, so you can very well understand how much the implementation will be there. And of course, industry also, the pharma industry, they also started circumventing many things. And through third party or through some other bodies, they have started supporting these doctors. So this is the scenario. Now, is it a very nice scenario? I leave it up to the discretion of the participants. I will not comment on that, but then this is what the guideline says. And when public, by and large, they come to know about all these things, obviously, they will not feel good about it. Now, how can you bridge this? What are the ways in which you can bridge this? How to improve trust between pharma industry and doctors? So one thing is, I mean, if you see that what the PwC suggestions were, by and large, if your marketing activities are patient-centric, right? Anything which improves the outcome of the disease, anything whereby it is going to be helpful for the patients, that is okay. That is absolutely agreed upon. And that is why you will notice many marketing activities, and that's a big challenge even for the pharma marketing teams. What sort of activities you should bring about so that it is aimed towards patients' education, towards the betterment of the patients. And in no way people should construe that this activity is going to be helpful in gaining prescriptions. And one very funny instance I want to share with you. When I was working with MSD, I had even started conducting these sessions with the doctors, and even with some of the leading hospitals like Baby Memorial Hospitals and some of the other hospitals. And I used to conduct the soft skill sessions for the doctors as well as for the paramedical staff. Now, I conducted one such session with one of the leading hospitals in Kerala, and subsequently, when I shared this report within our company that, look, this is what I've done, suddenly the compliance asked me, what is the purpose? Why did you do that? Will that impact the prescriptions in any way? And I had to give a lot of justification that, no, this is one activity which is not going to increase prescriptions, but it's going to be helpful in doctor-patients interactions, because I was talking about how they can improve the doctor-patient interface. So subsequently, whenever I was conducting program, I had to take approval from the compliance. So I'm just sharing that so much care they were taking that you should not do any activity by way of which indirectly are going to affect the prescriptions. Something very funny, but then that's how the company was so careful about it. So what are the things you can do? Well, the things, first of all, every organization must realize what are the requirements of the doctor with the relation to their patients, right? Again, as I've said, all the marketing activities must be aligned to improve the patient outcomes. So that is one. Secondly, partner in managing their patients. So any activity by way of which you can partner the physician in order to manage their patients, absolutely fine. Understand the preferences of the doctors. What do the doctors want? Co-creation of value, again, to improve the patient outcomes. So any co-creation of value you must do in order to improve the patient outcomes. And lastly, provide right authenticated information. I mean, any information which you're going to give, it should be properly authenticated, because out of the 9 reasons what I have enumerated because of which these companies, they were fined, one was wrong information and inability to provide the safety data, etc. So those were some of the reasons. And of course, you need to also use the technology for better patient engagement. So these are some of the ways in which the pharma companies, they can improve their relations when they are dealing with doctors. Now I come to my last part. How a doctor can improve their relations with the patients, because indirectly, directly, the pharma industry is going to get impacted. How the doctors patients relationship are going to be, because ultimately we also get revenue from that interaction only. Now again, here, what are the reasons between distrust between doctor and a patient? So few thoughts came to my mind. First of all, patients' anxiety and fear. I mean, these days patients, they are extremely knowledgeable. When a patient goes to a doctor, he had Googled something about the disease with which he is suffering. He has got a lot of questions for which he wants the answers from the doctors. And he also knows what is happening in the industry. So he's fully aware. So he has, because of all these reasons, he has got certain amount of anxiety and fear when he is approaching a doctor. Again, I mean, if you see the type of, the number of patients which our doctors are seeing, in one sitting, they are seeing 40 patients, 35 patients. And mind you, I mean, every patient requires a certain amount of time. So doctors' burden of work is also too much. Now, when this is the case, perhaps they are not able to give adequate amount of attention to the patients, and which also creates some amount of distrust. Fear of litigation. Nowadays, most of the clinicians, they are extremely scared, I would say, due to the fear of scared due to the litigations which many a times they had to face. Fear of verbal abuse. I will share with you a lot of instances where the doctors, they were manhandled by the patient's relatives. Very sad situation, but then that is what has happened. And that's also mainly because of wrong expectation settings and distrust between doctor and a physician, a doctor and a patient. Unrealistic patient's expectations. I mean, that's also a fact that, look, doctors, they try their level best. I mean, no doctor will, I don't think any doctor will not give his full attention in order to save a patient. But still, sometimes there are situations when the doctors, they are not able to save the patients. And when the patients, they're approaching doctors, also they have got a lot of unrealistic expectation. I might be weighing 125 kgs and I'm approaching a doctor and I am expecting him to bring my weight to 75 or 80 or even 90. It's not possible. So expectation setting has to be done by the doctors very clearly that, look, this is not going to happen. Only this much is going to happen, so that subsequently there's no such problem. Now, this is what I was sharing. I mean, these are many instances. These are some of the instances of the many instances which have happened where doctors and patients, relatives, they have fought and doctors were manhandled. So this is only because of the wrong expectation settings and mistrust between doctor and a patient. If that's the case, how we are going to resolve this? Now, there was one study which was done by Mike Stone, Director, Patients Association. It's an old study where they wanted to find out what the patients they expect from the doctors, right? And there were 5 things which came up as per this study. What they said that first thing what a patient wants is the eye contact, right? Nothing worse than not getting eye contact from the doctor. And mind you, when doctors, they have to see 40, 50 patients in one sitting, he has got many other things going on in his mind. Maybe that type of undivided attention which a patient expects from the doctor, he's not able to give. And if he's not able to give, again, the patients are not going to feel good and there will be some amount of distrust. Second thing, partnership. Even during 2003, as per this study, patients wanted doctors to be the partner in the disease management. It's not that doctors are only going to decide. I mean, the whole doctor-patient interactions, if I share with you, has undergone change from paternalistic model to many other, stages. And now the patients, they expect that, look, doctors, they must partner with me and they should actually help me in deciding the treatment options. Third thing, communication, right? Patients and doctors may have trouble in understanding each other, and that also creates distrust. There could be language barrier. There could be many other, like sometimes because of the aura of the doctor, also the patient is not able to express himself. So that's another problem. Time. I mean, if one wish could be granted, it is for more time with doctors. I mean, I remember, Arpan shares a lot of stories, but this is a live incident which I want to share with you. That once, 4 years back, rather, I had gone to US to meet my daughter and in New Jersey, and I had gone for a morning stroll. And out of my curiosity, I saw one hospital. I went inside out of my curiosity. I just wanted to see how the hospital setup is. And I went to the reception and I was just checking if I want to get myself examined, what is the way. And there was one young doctor who was standing. He said, "From which country you are?" I said, "I'm from India." He said, "What do you want to know?" I said, "I just want to understand what is the ecosystem, how you people are operating." And trust me, he gave me almost 10 minutes. And the sum and substance of that interaction was that they were seeing hardly 10 to 15 patients in a day. Their treatment was completely based on the guidelines, what they were having. And he said that, "Look, we have to follow the guidelines. If we don't follow the guidelines and if something untoward happens, the patients, they can sue me. So I will go strictly as per the guidelines. My treatment options will be as per the diagnostic reports, etc., etc." But as compared to that, think about our doctors, those, especially those who are working in government sector, 100 patients, they will be seeing 10, 20 patients, they will be surrounding this doctor. And in this scenario, he has to diagnose and prescribe medicine. So they are really doing great job, I would say, given the constraints. But patient's expectation was, even in this situation, doctors must give time, which is practically impossible. And appointments. Patients also express the desire that whatever time doctor gives, they must fulfill that. Now, these were the expectations of the patients. Now, I want to share with you something that when a doctor is dealing with the patients, there are few things which he need to understand. I still remember when I was a small kid and I used to go to a doctor along with my father. The doctor used to ask, generally, he used to ask the patients from which, what you have been doing, how many children do you have? And one of the reason was that these doctors, they always wanted to find out from which social background he's coming, so that when they are prescribing the medicine, they should keep that thing in mind. And in case the person is from a very lower socioeconomic strata, they were sometimes giving medicines on their own also without charging. So, I mean, that was the era. So understanding the background of the patient is important, even in order to build a connect with the patients. And that's another thing which you will appreciate. All the doctors, those who have got very good relations with the patients, they know their patients, not only with their name, but even with their family background and how many children is surpassed them. Style flex in communication is also very important when you are dealing with the patients. Facial expressions and body language of the patients, because that helps you in communication and you will understand what the pain points the patients might be having. Tone of the patient will also reveal a lot of things and involve the right person in the decision making, because sometimes the patient's relatives, they'll be important for the in the decision making. Now, I don't have to overstate that doctors, they need to listen to the patients. Like, for instance, this cartoon says that the pain starts in my husband's lower back, then it travels up to his spine, to his neck, then it comes out of his mouth and into my ears, and that's why I get these headaches. I mean, essentially, if a doctor is going to pay attention to the patients, you will be able to get the diagnosis correct. But unfortunate part is that there are many barriers, right? I don't have to highlight too much on this, but there are many barriers. Sometimes there's a lack of skills, inadequate knowledge and training, because nobody is imparting these softer skills to the doctor. No medical curriculum has got anything like this. And when you are undervaluing the importance of communication, obviously it leads to distrust between doctor and a patient. Now, if this is my last slide, bear with me. If you have to appeal to their reasoning, if you really want to build connect with the patients, there is a method in which you need to communicate, right, with the patients. If you want to build trust again, first thing is, you have to use a structure. You need to define a structure, how you are going to explain. Any communication which lacks in structure, you will not be able to communicate properly. So that's the one thing that holds true even for the doctors also, same thing. Again, provide evidences. So if I'm saying that you need to do this, where is the evidence? I mean, share the evidence also with the patients. So then the buying is going to be much better when you share the evidences. Thirdly, of course, spotlight the benefits. Like if I give you an example, if I share with any patient that every patient is different. Suppose I eat 2 idlis and Arpan also eats 2 idlis. Of course, he will not. He will eat something else. But in case he eats 2 idlis, our blood sugar increases are going to be different, though we are taking the same amount of idli. Why? Because our body construction is such that our blood sugar surges will be different. If this is the case, and if you put a CGMS patch and monitor how the blood sugars are, with what food items it is increasing for say 14 days, you will be in a better position to then adjust your meal pattern. So this way, at least you will know exactly which food items are going to increase my blood sugars, which food items are not going to increase my. So if you spotlight the benefits like this to the patients, they will be benefited. Of course, establish your credentials. And lastly, I mean, in case you feel that something the patients, they have not understood clearly, you can always ask questions. So these are some of the ways in which you can improve your interactions with the patients. So with this, I would come to the close, and that in every interaction, you have to be very courteous, right? It is very, very important. So what I have done today is I have dealt 3 aspects. 1, industry versus public. 2nd, industry versus doctors. And thirdly, doctor versus patients. With this, I come to the close. Thank you very much for the patient listening. In case there are any questions, we can discuss right now or even later also.
Yeah, thank you. Thank you very much, Pankaj sir. You can just, yeah. Okay. I think it was very elaborative and very new topic to the, LPC itself. And I think this is a very right time when the industry is actually restarting their, working, and it's very important for the industry as well as for every one of us to understand how to build trust. Because first I will take I have 2-3 questions, sir, in my mind, which I will post you first, and then I will give you the summary. That should be fine.
Okay, fair enough.
Okay, the first question will be, why actually there is a lot of the trust declining, especially in the pharma industry as a whole.
See, so Varmaji, as I've shared with you, there are many reasons for that. You see, the reasons start right from the companies, the marketing practices, what they have. If the marketing practices are not very correct, we are in this internet era. Anything which happens in any part of the globe, it is going to be known to everyone within the globe. I mean, we are operating in this type of transparent situation. Therefore, what happens is organizations personally, they do not want, the stakeholders, they do not want. But suppose there is some view head, somebody in the top position, suppose he's, deviates from the norms. And that is one of the reasons why all these good organizations, and especially those who are trading in New York Stock Exchange, any violation is dealt very severely. Person has to just lose the job. I mean, that is the capital punishment they straightway give if there is a slightest of deviation. Why? Not because they want to, hang these people, but because the impact of that one deviation could be catastrophic for the organization. They may have to close down their operations, right? So most of this problem is emanating because maybe 1 or 2 person is slightly deviating due to some reason or other. So that is one. Maybe the numbers are not coming. Therefore, in order to achieve the numbers, there's enormous pressure on them to deliver numbers. See, every organization will say you have to deliver numbers.
Yeah,
you have to deliver numbers within the ambit of the compliance, right? Some of the persons, those who are not so proficient, I would say, and they're not able to, they start resorting to the shortcuts. So that's one. Secondly, the marketing practices. You see, there is a lot of gap. MCI guidelines I've shared with you, but they're not binding. They're not binding. Of course, they are not binding on the company at all, but they're not binding. It's just a guidance to the doctors. And I must tell you that many doctors, after these MCI guidelines, have started declining things, right? But still, there is a lot of loopholes are there.
Loopholes are there, which
right, like it's not that the organizations, they cannot sponsor any doctor. I can sponsor, provided the doctor has got certain stature, right? If he is going as a faculty, no issues. If he is going as a delegate, and if he has got certain stature, certain number of publications he has, and if I'm sending him to say ADA, on this assumption that you will learn in ADA, and when you come back, you will disseminate this information to say 3-4 persons, 5 persons, 3-4 meetings or 5 meetings, or to X number of doctors. Yeah. I'm allowed to do that. So that actually gives some amount of leeway, right? So yeah, there are certain organizations, they are very particular about it. They will say, I have got this parameter. Yeah. If you're falling within the ambit of this parameter, you are eligible. Otherwise, you are not eligible. I know one of the doctor I had recommended when I was in one of the organization. Later on, this mandate came that you have to provide how many publications he has. And unfortunately, he was a physician. He did not have many publications to his credit. And the organization said, no, we cannot send him. He was to go to ESD. And this came just barely 2 days before. And I can't tell you, the doctor was so furious with me. He said, look, I have told my family members I'm going to Budapest. I have told, I have declined to some of the other organizations that I'm going already. And now 2 days before you are telling me that you are not eligible. I said, I'm so sorry. But then this is how it is. So there are a whole lot of reasons because of which this trust is declining. Good thing, I would say, positive thing is that the organizations, they are trying to, in their own way, trying to tackle this to a large extent. Thanks to the compliance teams which have been instituted in all these organizations.
Yeah, I think all big organizations now have the compliance teams, and
Yes.
they are actually controlling the entire
Yes.
marketing budget, and that's a good thing. And one more question to you, sir. How can pharma organization build credibility, okay, with the doctors?
I think first of all, pharma organizations can build credibility with the doctors by walking the talk. I mean, I'm a big fan of walk the talk, and helping the doctors in co-creation of value. See, every doctor is concerned about his patients.
Yeah.
Right. Now, when these are the guidelines under which they are working, they want at least the treatment outcomes to be better. So if we are keeping that patient in the center and trying to develop the marketing activities by way of which the treatment outcomes are going to be better, right? What are those activities? That, of course, the pharma companies, they will have to sit with the doctor and decide what sort of activities they can conduct. And there again, the compliance comes into being, right? Because they are very particular. You should not do any activity by way of which surreptitiously you are trying to increase the prescriptions, right? So they will view this, very, very minutely. But still, you can always work out certain activities by which the patient's outcomes, the treatment outcomes are better with the patients. So that is one simple thing. And whatever you say, you do that. I mean, there's no point in going back from that.
Awesome. I think you have covered almost, all the compliance part, as well as how what are the three different layers of the declining trust, especially the industry versus public, industry versus doctors, and doctor versus patients. And you also touched upon why pharma industry being a human centric, it should be a human centric and should now focus more on the patient relationship, build the trust between the doctors and patients, and partnering with the doctors in this journey. And also you touched about the MCI guidelines, which are I think they are evolving. For any guidelines or any law to actually implement, I think it will take some time, and it's going in the right direction. But what I liked most in your talk is the way you started with, you told that the organizations like Google, like Amazon, like Apple, how they are building trust, because for them customer is everything. Similarly, now the concept of patient centricity is coming in pharma industry, which is very, very important. And I hope the Indian pharma should actually take the lead in bringing this strategy into their marketing, as well as in their overall organization structure. Thank you very much, sir. Over to you, Yashwant.
Thank you very much. Thank you. Very, very interactive session. A lot of learning. We thoroughly enjoyed the process. And thank you very much, Pankaj sir, to sharing insight, which is very practical and relevant in today's context. Now, I would like to hand over to Sudeep for the next session, introducing Arpan. Unmute, Sudeep, unmute.
It is a great pleasure to introduce Mr. Arpan Kumar Paul. He's having around 25 years experience with as a medical representative, as a pharma professional with Zydus Catila. He has a vast experience, and he has started his own consultancy firm as a storyteller. Now he is giving the consultancy also, and he is a very well-known name in our LPC across India, across world now, to be a good storyteller. I am a great fan of him. So over to Arpan.
Thank you so much, Sudeep, for the kind introduction. In fact, I don't know whether I deserve so much of what you said, but definitely I try to create blue oceans in the world of storytelling, and then trying to correlate with the pharma industry. And one thing I really enjoy is the situational leadership, because this is something which brings out the best from any type of leader, because situations create leaders. The way leaders react to situation decide the metal they are made of. So often we find that there are great leaders who crumble in crunch situations. So it is the situation which make leaders. And today, as I always believe that stories are one of the best ways to bring any topic to our minds and keep it within our minds for a very long time. So now I will share my screen. Yes, thank you so much. Well, this is the age-old story of the tortoise and the hare. It is once again a race between two unequal people. Because the rabbit, as we know, or the hare, as we know, is the one of the fastest runners, and the tortoise always lags behind. So good old lessons in teamwork from an age-old fable. So as the story begins, that once upon a time, a tortoise and a hare had an argument about who was faster. Obviously, it was like asking Usain Bolt that who is the fastest person on the planet. So obviously the hare said that I am the fastest, but the tortoise said that no, I am the fastest runner. And this argument went on, and it went on to the situation where we all know that they decided to settle the argument with a race. And in fact, they agreed on a route and they started off the race. Here, one thing we need to understand, that none of them actually tried to bring out the core competency. The rabbit knew, or the hare knew, the core competency, which was running fast, but not the tortoise. He had just accepted the invite of the hare to run in a race without deciding its core competency. And often we find leaders who do not actually run as per their core competency. They try to go with the tide, which often puts them in trouble. So as it would have happened, the hare shot ahead and ran briskly, as we all know. But then while turning back, the hare found that the tortoise was lagging far behind, because the tortoise was basically plodding and the hare was running. So since it was summertime, as it is now, the hare decided to take a little breather and sat down under a tree to take some rest. This is where a leader may find complacency coming within. Because whenever a leader finds that I am achieving the targets, I am achieving the goals of the organization, so I can always do it a way which is known as the laissez-faire leadership, where we allow things to move as it is going without trying to innovate or trying to think of the future. This is where vision is very much required, the vision of the future. And often leaders suffer from myopia. That means they are able to see the present but are unable to gauge the future. So as it would have been, when the hare decided to take a breather and take rest under the cool shade of a tree, it actually fell asleep. So this is a time when a leader is taken unaware of the situation, and often this puts him or her into trouble. So the tortoise was slowly prodding, as we all know, and the rabbit was sleeping. And yes, the tortoise actually overtook the rabbit and emerged as an undisputed champ. This is a story we all know. And as time would have it, when the hare woke up, he realized that he had already lost the race. Now, what was the realizations and the moral? The slow and steady wins the race. But does it always happen? And this is the version of the story that we have all grown up with. From the time we started reading stories, and this was one of the stories we probably had a chance to read the first. But then the story continues. The hare was disappointed for losing the race, and he did some soul searching. He tried to find out why he lost the race. And this is something what we do, a post-mortem. In our pharma industry, we have three basic things that we should do. That is a feed forward and a concurrent and a feedback. We rely heavily on a feedback, which is generally a post-mortem, because after the doctor call is done, a leader or a manager generally takes the medical rep to the chemist shop, and there they take a feedback, but a feedback is a post-mortem, and we cannot restore things till the next visit. So the best thing that we can always do is a feed forward, which is often done before we start the call. Before we start the visit, we plan what we are going to do, or we try to take a gauge of the situation we are in. So that is feed forward. And then the second part is concurrent. While we are with the customer, slight changes or modulations that we require during the course of the event is the concurrent. Because maybe we had planned to say something, but we find the doctor in a different sort of a mood. So as per the situation, once again, situational leadership comes here. We have to mold ourselves as per the mood of the doctor. And that is what is known as concurrent, because at the end of it, the feedback, we cannot do anything. We cannot restore the situation till we next come to the doctor. So also the hare here did some soul searching, and he realized that he had lost because he was very overconfident, careless, and lax. Now, why does overconfidence creep in? Overconfidence creeps in because we feel that we know everything. And there are basically three types of overconfidence. The first one is overestimation. Overestimation happens when we feel then that we are better than we actually are. And many leaders suffer from that because we always try to feel that we are much better than what the actual situation is. Second is overplacement. It's an exaggerated situation that we are better than others. Often we consider others inferior, and that leads us to a situation which is known as overplacement. And the third is over precision. And it is a situation where the leader believes that he knows the entire truth. Whatever the leader knows, that is the truth. And that is exactly what has happened. But it is said that a coin has two sides. We have only seen one side, not the other side. And it is very difficult to understand the situation a person has passed without putting ourselves into their shoes. So that is exactly the third situation, which is over precision. And these are the three types of overconfidence that leaders generally suffer. And that is why the hare thought that if he had not taken things for granted, there is no way the tortoise could have beaten him. And then what happened? He challenged the tortoise for another race. And the tortoise agreed, because now the tortoise was confident or overconfident that he will win the race. And this time the hare did not leave any stone unturned. He started the race and he completed the race and he won the race by several miles. Because this time the tortoise actually, at this time the hare actually believed that if overconfidence or complacency creep within him, he will not be able to win the race. And this is something we would always like to have the leaders, that whenever you know that you are winning, don't stop, because the purple patch does not last for a long time. So when you are in a winning spree, when you are doing everything perfectly, try to carry out those things as long as you can, because you never know when situations are going to change. And COVID has been an eye-opener for all of us that situations are not permanent. Situations can change. It is our learning and development. It is our upskilling. It is our reskilling that is going to make us ready for the situation. So whenever we are in a good situation, let this good situation continue and let us do all the good things that we have done to make this situation much better. And that is the lesson that the hare taught us. The fast and consistent will always beat the slow and steady. And if you have two people in the organization, one slow, methodical and reliable, and the other fast and still reliable at what he does, the fast and the reliable will consistently climb the organizational ladder faster than the slower or the methodical chap. And this is situations we have always seen, that people who do things very fast, people who achieve milestones very fast, they climb the organizational ladder much faster. So it is good to be slow and steady, but it is better to be fast and reliable. So in the number game, the person who is always the first to achieve the numbers gets the accolades, gets the credit. So the leaders need to motivate their teams that they must get success very fast. And not only that, they must make the success last for a long time. But the story doesn't end here. There is a third part of the story as well. The tortoise did some thinking and this time realized there is no way he can beat the hare in a race the way it is currently formatted. Now here we are basically trying to play to our strengths, because here the core competency of a leader comes into place. Even a leader who has a team under his belt, he is also going to try, he also needs to know what are the core strengths of his team members, because not every person in the team can do everything very well, but there can always be specialists in the team where one person is better equipped than the other in doing a certain team. So now what happened? He thought for a while and challenged the hare for another race, but on a slightly different route. And here the hare agreed. Now this time the hare became complacent because he actually did not understand what the change in route meant to the hare. Okay, so they started off, and in keeping with the self-made commitment to be consistent, the hare took off fast and ran till he came to the edge of a broad river. Now what happened? We all know that the hare cannot swim, and the finishing line was a couple of kilometers on the other side of the river, and this was a course that the tortoise had designed suiting his own core competency, that the tortoise can swim. So the hare sat there wondering what to do, and in the meanwhile the tortoise just crossed the river and swam to the opposite side, continued walking and finished the race. So what should the hare do here? The moral of the story. Well, there are many things that we need to understand here. The first is the Johari window. In fact, the Johari window is a very, very important part as far as learning and development is concerned. The Johari window has got the 4 quadrants: the open area, the blind spot, the hidden area, and the unknown area. Well, the open area is something which we know and others know, what our strengths are, what our weaknesses are. The hidden area is what we know, but others don't know. The blind spot is what we do not know, but the others know. And the unknown spot is what none of us know. So for a person to be a good leader, he needs to identify the blind spots. But can we identify the blind spots ourselves? Probably we cannot. Because when we are trying to reflect our own strengths and weaknesses, we are only able to gauge our strengths, and probably more than we have. But as far as the weaknesses are concerned, most of them are not identified by us, which becomes the blind spot. So for that, a coach, a mentor, a trainer, a guide becomes all the more important, because this person is going to identify the lacunas, the shortcomings, the weaknesses that a person has. And this is a place where training becomes so important, because whenever we go by the ADDIE model, that is analyze, design, develop, implement, and evaluate, the first thing that we do is analyze. And when we analyze, we basically try to find out not the weaknesses, but the underdeveloped strength of that person, the areas where that person can improve and be better. And that is the blind spot which a trainer always aims to identify and try to do the necessary correction. Because once again, I will say 3 things, 3 words that begins with C: the critic, the cheerleader, and the coach. A critic is a person who will always try to find out your shortcomings and point it out. A cheerleader is a person who will always try to glorify your strengths. But a coach is a person who is going to be patient enough to find out where the shortcoming is and to try to rectify it, so that we can become the better version of ourselves. So this is where we first need to identify the core competency. In organizations, what happens sometimes, is known as the dead horse theory. In fact, this dead horse theory was taken up by the Dakota Indians. They said that if the horse is dead, the best thing is to get down from the horse. But in many organizations, they have taken strategies which have not done really well. In fact, those strategies have actually backfired. But companies or organizations still continue to follow those strategy, continue to implement those strategy, even when they know that this strategy is not going to lead them anywhere. But the real thing is that those strategies are never going to do any good. But what happens with organizations? These are ways they try to still carry out the dead horse theory. First, they try to bring a stronger whip. That means they try to do everything that is coercive to the people so that they even try harder to ensure that the strategy doesn't fail, it actually succeeds. We all know that this strategy has been designed wrongly and it is not going to succeed. But bringing a stronger whip, that means I'm going to hit the horse even harder. I'm going to hit my people even harder. I'm going to be very coercive in my approach. And that is often what a leader tries, so that he can try to bring out success from a strategy which actually doesn't yield anything good. The second thing they may do is change the rider. In fact, they would bring another leader, but not change the strategy. They will bring another leader and try to make that leader implement the strategy and bring success to it, which also doesn't happen. Third, they might threaten the horse with termination. This is one thing that is followed very often. They threat the people that they are going to be terminated so that they try to do out of their skin, but that often doesn't work anything. More interestingly, appoint a committee to study the horse, spending even more money on a strategy which is not going to do. And finally, promoting the dead horse to a supervisory position. So these are all the strategies which are followed in organizations, knowing very well that the strategy doesn't work at all, and still trying to do as much as they can and spending more funds on a strategy. And finally, it leads to a downfall. So first, identify the core competency and then change the playing field to suit the competency. And my dear friends, in an organization, you should always try to show what your strengths are, because if you are a good speaker, you need to create opportunities to give good presentations, because nobody is going to give you the opportunity. You need to create the opportunity. You need to speak in front of the person that matters. You need to speak in front of the person who would really recognize your talent and give justice to that. If I am good in analysis, then let me do some research and present some data to a person who would definitely cherish it and who would definitely translate my talent into better opportunities. So friends, just working blindly will never help us. We need to work very cleverly. That is why I always believe that working to your strengths will not only get you noticed, but it will also create opportunities for growth and advancement. We all enter the pharma industry through the gate of a medical representative doing sales, but not everybody is good in that. There are many avenues which are created as we go higher up the ladder, and these opportunities bring us success. But then we need to find out what we are good in. We need to find out what we are suited in, and that is going to bring us success. So the success has to come by creating opportunities. We have seen MS Dhoni in his struggling days in the movie, The Untold Story, where Dhoni was trying to hit the balls to the boundaries or sixers where the selectors were sitting so that he would get noticed. So something that is very important is to get the notice from the people who matter to us. So the story still hasn't ended. Now, by this time, the hare and the tortoise have become very good friends. And now they thought that what is the basic purpose of us being competitors? Both realized that the last race could have been run much better. And so they decided to do the last race again. And this time as a team. That means instead of being competitors, they tried to be collaborators. They started off, and this time the hare carried the tortoise till the river bank. And then the tortoise took over and swam across with the hare on the back. Now what happened? On the opposite bank, the hare again carried the tortoise and they reached the finishing line together. Now both of them had a great sense of satisfaction than they had felt earlier. Because in collaboration, people and organization thrive in the environment. When everybody comes together and work as one, the workflow becomes smoother. Tasks can be achieved quickly and effectively, and healthy relations can be formed, and productivity can increase like anything. And in fact, organizations which promote collaborative working are 5 times more likely to perform better and have lower employee turnover and higher profitability. So this is the power of collaboration. And the moral of the story, well, it's good to be individually brilliant and to have strong core competencies. But unless we are able to work in a team and harness each other's core competency, you will always perform below par, because there will always be situations at which you will do poorly and someone does well. Now it is up to the leader once again how he deals with the situation, because again the leader has to decide to whom he's going to delegate the task, because not two people in the team are alike and they have the same core competency. So if it is a task of doing the number games, there will be someone who is good at that. But if it is a task of making a presentation, well, there will be another person who is good at that. So teamwork is mainly about situational leadership, letting the person with the relevant core competency for a situation take the leadership. And Saurav Ganguly always had 3-4 captains within him. He always had Zahir Khan as the bowling captain. He had Yuvraj and Mohammad Kaif as the fielding captain. And Rahul Dravid, being the vice captain of Saurav Ganguly's team, took a major share of the responsibilities of the team. So the most important part of situational leadership is to delegate the task to the right person who can do justice to that task. So there are more lessons to be learned from this story. We need to note that neither the hare or the tortoise gave up after the failures, which is very important, because failures are the pillars to success. And every rejection is basically a redirection. The hare decided to work harder and put in more effort after the failure, and the tortoise changed his strategy because he was already working as hard as he could. So sometimes when we are working very hard and we are finding that we are still not able to taste success, it is time we change the strategy, because insanity is doing the same things over and over again and expecting different results. And this witticism is called the Einstein's insanity. In life, when faced with failure, sometimes it's appropriate to work harder and put in more effort, but sometimes it is appropriate to change the strategy and try something different. And sometimes it is more meaningful to do both of them. So the hare and the tortoise also learned another vital lesson, and in fact taught us. What was that? When we stop competing against a rival and instead start competing against the situation, we perform far better. In fact, to sum up the story, which is my last slide, it teaches us many things. Never give up when faced with failure. Let me take you back to the 1983 Cricket World Cup. There was a match between India and Zimbabwe. India had gone down for a paltry 5-wicket down when Kapil Dev came to the center. And the innings of 175 not out was very much instrumental, not only in lifting the World Cup, but in fact reviving the team, getting the lost confidence back within the team members, because he was able to rub a lot of confidence on the team members by the knock of 175 not out. And this knock of 175 has been etched in the annals of the World Cup history for India as one of the best knocks by a captain. So never give up when faced with failure. In fact, another example of this same World Cup is when Kapil Dev took the catch of Vivian Richards in the finals of the bowling of Madan Lal. In fact, this was a catch which sealed the fate of the West Indians in the 1983 final. So once again, leadership at its best, because Madan, in fact, asked Kapil for one extra over after getting hit left, right, and center in the previous over by Viv Richards. And this is where Kapil thought, ki chalo, let me give Madipaji one more over so that he can get the best out of the failure. So never give up when faced with failure. Next, fast and consistent will always beat the slow and steady. Well, your start doesn't decide where you reach. It's what you do in between. We have always watched Usain Bolt when he's running the 100 meters. Is he the fastest of the block? No, he isn't. He's one of the slow starters. But what he does in between is what takes him fast to the finishing line. And that is what Usain Bolt is. So your start is never going to decide, never going to determine where you reach. It's what you do in between. The hard work, the perseverance, the dedication, everything that we put in behind our work, so that the work becomes a pleasure. It is never a pressure. We love what we are doing, and that is we are doing that. And so the fast and consistent will always beat the slow and steady. Work to your competencies. We must always work to our strengths, because that is where our success lies. Recently, the movie had come of Praveen Tambe. In fact, Praveen Tambe had started his career as a fast bowler. It was probably in the halfway in his career that he realized that he is not made to be a fast bowler. He changed over to leg spin. And that is where his success came at the age of 41. So never give up. We may be heading in the wrong direction, but it is never too late to change the direction, because that is the place where we discover our competencies. Many people take the wrong move, but in between they realize that yes, they were on the wrong road and they immediately change. So that is why we need to work to the competencies. And I am an example of that. Compete against the situation, not against a rival. Yes, MS Dhoni got a chance to represent railways. We have all seen the movie. He never got a chance to represent the railways because the coach never thought that his style of batting was suited, because he was a bit unorthodox. But did that person stop Dhoni from being what he is today? MS Dhoni has been very inspirational. And in my talks, I always ensure that I have few incidences of MS Dhoni, because he is a person whom we can say Mukaddar ka Badshah, a person who rose from rags to riches, and a person who has proved that from where we start doesn't determine where we end up, because it's what we do in between. So MS Dhoni did not get a chance to play for the railways, but he became the India captain, World Cup winning captain. So he did not consider the coach of railways a rival. He instead fought against the situation. He is having good terms with everybody, because no person is a rival. It is the situation which goes against us. So situation doesn't always remain the same. Situation has to change. It will change, but it only needs preparation and belief from our end, belief in our capabilities that we will succeed. And finally, pooling the resources and working as a team will always beat individual performers. The last example is the Pakistan's 1992 World Cup victory. Pakistan team, cricket team, we all consider to have excellent individual performers. They have a strong breed of fast bowlers. They have world-class spinners, and they have the finest batsmen in the world. But on the world stage, why are they not able to perform? Because they do not have a leader who is able to make them play under a banner, under a team. And in fact, Imran Khan could do that. And in 1992, Pakistan had their only World Cup success. So that is why it is the leader, a leader like Imran Khan, who could make the people believe, the players believe, the team believe that yes, they can win the World Cup if they play to their core strengths. And that is exactly what they did. So dear friends, let's go and build stronger teams. Don't be afraid to change because it is leading you to a new beginning. We must always try to embrace change because that is something that will take us to a new direction in our career. Thank you so much. This was my humble way of trying to bring situational leadership in front of all of you. Thank you so much.
Wonderful, wonderful, Arpan. Amazing narrations and presentations. So I can draw a conclusion from your story that situational leadership is a teamwork is very much important, and delegation to the down the line is one of the core area for the situational leadership. And I came across one proverb recently, which is very much meaningful, that you cannot win by avoiding the competitive competitions. You can win the game by competitive competence. So competence level has to grow up by learning and development. So fantastic direction. I have few questions to you in this storytelling relations. Now, at the doctor's front, how we can put the stories to make the doctors in our front, in our fold? Is any a way?
Well, in fact, thanks, Sudeep, for the question. In fact, whenever we are going to a doctor, we are always full of stories. What we are detailing is a story, a narration that we are trying to get the doctor's attention. Now, why do we tell stories? Why do we have a visual aid that have some visuals, some stories, some narratives? It is just to get the attention of the doctor. Otherwise, we would have just gone there, told the name of the product, the dosage, the indication, and the price, and came back. Why do we narrate the story? A story is nothing but an attention grabber. And an attention grabber is something that basically helps the doctor to retain the brand name with the help of the story. So stories basically work as an adhesive. It's a glue to make the brand name stick in the minds of the doctor. And the better the glue, that means the better the story, the better will be the recall of the brand name and more will be the prescriptions.
So you always suggest that that the punch of the stories in the visual aid, the communication and detailing will have a better effect to remember the brand name.
Yes, definitely, because stories are the glue that add to the memory of the doctor. Because whenever we are just telling a brand name, I feel in the overcrowded market of brand names, this brand name might be lost. So if we add a story which is good enough to sensitize the doctor, then I think the story will be the glue which will make the brand name stick to the mind of the doctor.
Fantastic, fantastic clarity. And I want to know one more thing, that when we are presentations are going on with data, how we can correlate storytelling with data?
Well, storytelling and data, they are absolutely related to each other, because I have often seen presentations which are done in front of people. Presentations often put the listeners to sleep.
Yes.
I have often seen PowerPoint presentations putting the listeners to sleep. I don't blame the listeners. I blame the presenter, because when we find that a presentation is putting the audience to sleep, it's time to wake up the presenter, because the presenter does not have a knife which is sharp enough to make the presentation reach the audience. So for that reason, if the presentation is made with the help of stories, because stories will add to the interest, because whenever think of a presentation we are doing and we start by telling that, friends, let me tell you a story. So what is the exact reaction? When we say that, let me tell you a story, you will find that automatically that attention is taken from the listeners or the audience, because we have a gene within all of us of having an interest for stories, because when we were young, we used to be told the stories from our childhood. Our grandparents, our parents, they have told us stories, and that is why they have a very special place in our heart. So whenever we relate a presentation with a story, we can always expect a better attention from the participants or the audience.
Excellent, excellent insights. One more question I want to have now. How to build that story banks because we should have the story bank with us to relate. So what you suggest to have a story bank to the people?
Yeah, in fact, see, story bank means a repository of stories. It's basically a repository of stories that are going to work on different situations. Yeah. Because we have stories which will be on different situations, and every situation is not the same. There might be a situation where a leader might be required to take immediate action. There might be a situation where the leader has to be a little bit coercive. There might be a situation where the leader needs to rub shoulders with the team, and every situation does not have the same story to the liking. In fact, I will tell you a story which will be very apt for this. We all believe in karma, isn't it? We all believe in karma. So the eyes of a person saw some juicy mangoes. This is summer season, and we all love mangoes, don't we? The eyes of a person saw the juicy mangoes hanging from the trees. And when the eyes saw the mango, there was always a lust to try the mangoes, but the eyes cannot walk. So what happened? The legs started walking and it approached the tree. But can the legs pluck the mangoes? No. The hands have to take the initiative. Now the hands pluck the mangoes. But can the hands eat the mangoes? No. The mouth has to eat the mangoes. So the hand took the mango and put it in the mouth. But can the mouth digest the mangoes? No. It's the stomach which has to digest the mangoes. So the stomach came into place. Now, while this entire process was happening, the gardener saw this person stealing the mangoes. And he came with a stick and hit the person. Now what happened? He was hit on the back. The back said, I had no role in plucking the mangoes or eating the mangoes. But then what happened? When the person was hit with the stick, tears started rolling down his eyes. What did the eyes do first? The eyes saw the mango. And when the person was hit, tears started rolling down the eyes. So this is karma. What you do will come back to you. In a different way, we will never understand. This total thing is a circle. It's a circle that happens. But believe in karma. We are definitely going to reap what we sow. So let us sow something good for everybody. Thank you, Sudipta, for this question.
Fantastic insight. Really awesome. So what I understood, story are powerful. Evolutions and biology have a role to play great in our industry. Thank you.
Thank you
so much.
Thank you very much, Arpan. Wonderful stories, series of stories, and very good summarization by Sudeep. Fortunately, there are many of our known people in the audience who are enjoying the story also, and they have some questions also. So it is time to recognize those people who are regularly there, starting from Somitra Bhattacharya. Thank you very much, Somitra, for appreciation. Arumugam Arasan, thank you very much. Mahesh Pujari, thank you very much for attending and appreciating our session. Nasiruddin Chishti, thank you very much. Hitesh Suprati sir, thank you very much, sir, has joined from Uganda and appreciating great going team LPC. Hitesh sir has run. Sir, thank you very much. Keep inspiring. Prabhakar Jha, thank you, Prabhakar. Old story with a new perspective. Yes, that is what Arpan has brought. The same story, what we have studied, seen, read in our school days, now with a new perspective, with a leadership dimension. That is the power of Arpan, the storyteller. Then Prashant Menon sir has also attended and shared. Stories are a powerful way to explain solutions on how to manage many situations. So a relevant session. Cheers. Thank you very much, sir. Keep on sharing. Rohit Vilankar has appreciated also and have questions also. Rohit says, eye-catching presentation, Arpan sir. Good morning, LPC. That is okay. Bipin Kumar Dikshit. Good morning, LPC. Thank you very much. I am attending from Ethiopia. So Bipin, thank you very much for joining from Ethiopia. You all give us a lot of encouragement. Now, question to Pankaj Srivastava sir. Sir, thank you very much. There is a question from Rohit Vilankar. How can pharmaceutical representative bridge the gap of distrust between doctor and patient? Can training do play a role? Pankaj sir, very apt question. Again, I will read it. He says, how a pharma company or representative can bridge the gap between distrust between doctor and the patient. Many times, as you shared, many patients relative beat the doctor without any reason. So how it can be, distrust can be bridged, and what pharma company can support?
I think very nice question and very relevant question, Yashwantji, as you have said. See, first of all, there are two parts of this question. One is the trust between pharma representative and a doctor, and how a pharma representative can help a doctor in further ensuring the trust between him and patients. So first thing, coming back to the first part, first thing is a pharma representative can build trust. As I've shared with everyone in my presentation, that see, now the time has come where a pharma representative, instead of just going and talking scientific information, please understand, doctors do not have that sort of time now because they know the scientific information. Think about it. I mean, if I'm going and talking about DPP-4 inhibitor, which has been listening for last almost 15 years, right? He's not interested in that. But if I go and talk to him how I can help his patients in having better treatment outcomes, he's interested in that. So that is the slight twist which is required. Now, as far as scientific dissemination is concerned, well, as I think in past I've shared with you that the marketing has to play a major role. They have to prepare small bites and in the form of some small videos, they can push that scientific content. Maybe they can take up that responsibilities, and the role of our pharma representative will definitely undergo a change. It cannot be same what was there 4-5 years back also now in this current situation. So that is one. And if as a doctor, if I know that, say, Yashwantji is coming to me and he is interested in my betterment, in my better treatment outcomes, I will definitely be interested. Like, I'll give you example. Suppose there is some way in which a pharma representative can help me in increasing my footfall. I'll be interested in those activities. So if you say that, look, can you create blogs? We will publish those blogs. Once you publish these blogs, the people will read, they will understand about me. I'll be interested in those type of activities. So if I am going to a doctor and I'm going to discuss not my scientific content, but I'm going to discuss, sir, what are the topics where you can, say, publish your blogs, and what are the things, what are the activities which I can do by which the footfalls are going to increase. Say, for instance, standees. Nowadays, a lot of technical things have come. QR code, for instance, is a beautiful way of giving the complete insight of the doctor. Suppose you print a QR code on a leaflet, and that leaflet doctor gives to the patients. And that once you scan the QR code, the entire profile of the doctor, what he has done, everything is there, which a doctor doesn't have to tell to the patients, but by just simply scanning, I come to know as a patient. Those are the type of activities. A lot of innovation has to be there by the pharma representatives, by the pharma companies, how to engage with the doctors to have a meaningful conversation. That is the first part. Coming back to the second part, how a doctor can foster a better relationship with the patients. First thing is right expectation setting. You need to set right expectations. See, you are not God. If a person is coming in a very terminal stage, I mean, it's better to tell, look, I will attend to the patients, but then this is the situation. Once the expectation setting is done properly, at least the mistrust will be lesser. Thirdly, most of the patients, they are extremely wary of the diagnostic test which a doctor is going to prescribe. Now, sometimes most 90% of the times the diagnostic test and all those paraphernalia which a doctor is going to suggest to patients, they are very much needed. I mean, I firmly believe none of the doctor would like to suggest anything just like that. They are very much needed. The only thing is, because of the so much media attention and media exposure of all these things, it is better if a doctor explains that. Why is he suggesting that? It will require certain amount of time, which a doctor is hard pressed these days to give time. But still, if we can explain that look, this is the reason because of which I'm suggesting, I think the trust deficit will be reduced to a large extent. I hope I have answered the question.
Yes, sir, very much. Thank you very much for giving insight. Very insightful share you have given, and it addresses all the issues between the doctor, patients, and pharma company, because it is an emotional connect they have, and it is very important to have a very strong equity with them. So thank you very much once again, sir. It was a wonderful session. I have already shared Facebook as insights, from YouTube also 2-3 very core people who have been watching and appreciating Madhuri Doshi, and particularly Rajat Shah, who is a core team member. He has said wonderful ways of storytelling. Thank you very much, Rajat da, for attending and appreciating. It was a wonderful learning from each one of us. We thoroughly enjoyed. So let us connect again. I think we have come to the close of the session. So I would request closing remarks from everyone. Over to ICS, sir.
Yeah, so before the closing remarks, even I have a few more names who have joined from Facebook. We have Naziruddin Chisti, Mahesh Pujari, and we have Jitendra Bharadwaj, Satyabrata Mukherjee, and Armugam Arasan as one of the very consistent and a great leader who has been with the LPC from many episodes, and Mr. Vipin Dikshit. So these are some of the others whom I think we should recognize them. Thank you very much, guys, for your love and appreciation to Life Pharma Coalition. And so today these two topics are completely different, and we had a lot of learnings, especially from Pankaj sir. We have got the exact gap, where exactly the gap in the pharma industry, and how actually the organizations can pick this gap and can create a lot of value addition to the doctor-patient relationship. I think this is an excellent topic. I think we need to have more these kind of topics, so that pharma is going to get into a right direction. And Arpan's storytelling again is being very favorite to all of us, and he had brought a lot of series of stories today on leadership and how you can actually improve your presence through stories. So thank you, Arpan. So these I have got a lot of learnings from today's session. Thank you very much. Yeah, over to you.
Thank you, sir. Thank you very much, sir. Sudeep, once again, thank you for joining. And how was your experience? Closing remarks from your side, Sudeep.
Yeah. Wonderful experience. A lot of learnings for me, especially when our Srivastava sir has narrated the industry versus public, industry versus doctor, and doctor versus public relationship, where the mistrusts are going on, how to collaborate the situations, synchronize the situations to have a better relations with the doctor versus public versus industry. It is a great insight. Definitely, it will be helpful for all of us, like professionals, to make the things more happen. And Arpan is undoubtedly, he's a master in storytelling. I already told I am a great fan of him, and I had some queries so that which have been clarified. So it's a great learning session for me, and I wish our team, Life Pharma Coalitions, to go ahead. All the best.
Thank you very much, Sudeep. Thank you very much. We'll look forward to you in future also. And over to you, Pankaj sir. Thank you very much, sir. And your closing remarks.
So, Yashwanji, my closing remarks are going to be same as my topic was. See, in every interaction, whatever we are having, any human interface, what we are having, our conduct should be such that which should foster trust, right? And we should not do any such thing which, even if it is discovered later on, can spoil my trust. We should always bear this thing in mind, that fine, today it will not be discovered, but suppose it is discovered after 4 years, 5 years, whatever goodwill I have been able to build up will be spoiled within no time. If this realization is there, and one of my previous managing director, Mr. Vivek Kamath, he always used to say one thing, you should always not do anything which you cannot tell your mother, right? So if this realization is there, and then you are conducting yourself, the chances are that the trust you will be able to instill in every interaction.
Thank you, sir. Thank you very much once again. Arpan, are you there?
Yes.
Yes,
Yes, Arpan. Arpan, closing remarks from your side.
Yes, thank you so much, LPC, for giving me this opportunity to come over as a speaker. Well, I was last as a speaker on LPC on 28th session. So today is the 108th session. So it was 80 sessions which have gone in between, in which I have tried to engage myself in learning from so many stalwarts who have been on this LPC platform. Indeed, Pankaj sir said something which is really, really praiseworthy, which is about trust, because trust, I believe, is just like a glass. If there is a small crack, it is surely going to break. You cannot stop it. So that is why you said something, that never do anything which you cannot reveal to your mother. Very true. And as far as situational leadership goes, I think this is one of the best qualities that determines the future of a leader, the success of a leader, the charisma of a leader. And in fact, I will take one situation of a situational leadership, which is known to all of you. The situation is the 2007 inaugural T20 World Cup final. And let me take you to the final over. India versus Pakistan, Misbahul Haq at the crease. 13 runs to score in the last over. There were two options, either Harbhajan Singh or Joginder Sharma. Who was the leader? It was MS Dhoni once again, who was on his trip as the maiden captain in South Africa for the inaugural T20 World Cup. And this is what is called the Badshah of strategy, the Badshah of thinking. In one interview, I heard MS Dhoni telling that in one of the matches in Kenya for one under-19 or under-21 team, he had seen Misbahul Haq hitting spinners better than that of medium pacers. So he just took a gamble. He brought on this rookie who is Joginder Sharma. He throwed him the ball. Joginder got hit for a 6 on the second ball, but that did not stop him. Why? Because the team member believed in the confidence of the captain that yes, I can do it. And that is what situational leadership is all about, where the team member has got the faith on the captain and the captain has got the faith in the team member that yes, he will be able to deliver. And that is exactly what we need today in the industry. Even if you are a rookie, an outsider, a newcomer, don't go by where you have started. Please, you are as good as your last match, as you are as good as your last ball, and you are as good as the ball that you are going to bowl. And that is exactly what we all want this industry to think. Don't go by what has happened in the past. Dwell in the present and think of the future. And that requires the mission and the vision. Don't be myopic. Have a clear vision. See the future. Thank you so much.
Thank you very much. Wonderful, wonderful insight. Thank you very much, Arpan. It was a wonderful learning session from everyone. So let us close the session here. Thank you very much, all the viewers, for your continuous support and encouragement. We look forward for many more sessions in future. Thank you. And last but not least, thank you, Imagica Health, for continuous support and live streaming our sessions. Thank you very much. Let us keep in touch.
Thank you. Thank you very much.
Thank you so much. Thank you so much.
Thank you.
So thank you very much. So from here, I'm ending this meeting.
Yes.
Thank you.
Thank you.
Thank you.